Welcome to In Your Neighborhood. I'm your host, Chris O'Rourke. As we continue our series, Conversations on COVID-19, our subject matter for today is one that is very much in the news: masks. We are going to be talking all about masks in these segments today, and we're going to be starting off with a man who is a regular on our program now, and that is Dr. Stanley Martin from Geisinger Medical Center, the Director of Infectious Disease. Dr. Martin, thanks for joining us today.
Absolutely. Thank you, Chris.
Okay, so initially, back at the beginning, back in March, there was admittedly some confusion and some mixed messaging about masks. What led to the big push to eventually wear them?
Well, a couple things. I think, one of the things that early on was a reluctance about masks in the community setting was we didn't have enough information about the spread of the virus. We also were facing a lot of potential shortages of masks, right? And everybody wanted to make sure that we were going to have enough in our hospitals. We seem to be doing a much better job from that standpoint across the country, although some resources are still pretty strained. But what we have definitely seen is better and more science, right? We have seen that the implementation of mask wearing mandates and measures have had the greatest impact on the spread of this disease in the community. And so that's why you hear more and more about the need for masks.
So initially it seemed like washing hands might have been the main guidance, and then social distancing. Would you agree that now they're still important? Yes. Would you agree now that the mask wearing seems to be the most important element now?
It is. And, when you look at the different things that you can do to mitigate the spread of the virus, the masking seems to have the biggest effect in the community setting. And so, yes, the social distancing, yes, the hand hygiene, those things matter too. But if you're going to get the biggest bang for your buck, it's going to be with the mask at the end of the day.
So how do they work to protect us and everyone around us?
Right. So when somebody has this infection, they're kind of spewing out these microscopic respiratory droplets, right? And you do that even if you don't have this infection. You do this by virtue of talking, by virtue of breathing, singing, whatever. And these droplets, they come out of the mouth, they come out of the nose, and they tend to kind of shower around the individual. And most of them drop from gravity to about a 6-foot radius. Actually, most of them drop within about 3 feet, but 6 feet is, for the most part, where you see the majority. Very few, even smaller ones, may spread farther in certain situations. But because of that, the mask has a twofold effect. First of all, it prevents a lot of the droplets from the person who actually has the infection, right? So if I have the infection, I'm wearing the mask, then I am preventing those droplets from coming out into the community around me. And remember, not everybody gets super sick with this infection, right? A lot of people have very mild symptoms, or they have no symptoms at all, right? And so you may think, I'm fine, I feel okay, but you could in fact be a carrier of this infection. And so if you put on the mask, you are helping to protect others. Now, and then of course, if you're not infected by being out in the community and you're wearing your mask, then it's helping to prevent you from inhaling those respiratory droplets, or if you're touching them on a surface and then you're touching your face, right? That can be a potential route of transmission too.
So is there a right mask to wear for the general public? Is a bandana or other piece of cloth effective?
Yeah. So the type of mask you use may vary depending on your setting, right? So for instance, this is my, what we call level 1 medical mask, right? Right. And these have a fairly decent seal around the face, and they have a very small filtration capacity, meaning very, very tiny droplets that will filter out. Now there's a mask that's a level higher than this. We call an N95 mask, right? Which can form an even tighter seal and can filter out even smaller particles. And that is useful for people who are in the hospital taking care of a COVID patient, right? They're in a small room with that COVID patient. They're doing things with the respiratory tract, which may generate aerosols, and it becomes, more important that they have a much tighter mechanism in place to prevent the spread of the droplets. But in the community setting, right? You're just going to the grocery store, you're just going to the hardware store, then a cloth mask actually is perfectly adequate and does a great job at preventing enough of these kinds of droplets to have a big impact on the spread of the infection. So that's why, you can use these kinds of homemade cloth masks in that kind of situation if you're just going out of your home. Now, bandanas, bandanas are cloth. They will help. Absolutely, they will help. But of course, the bandana is generally kind of open at the bottom, right? And so it's not as ideal. But if that's all you have, then absolutely, use it.
Okay, so how should a mask be worn? I've seen them worn in many, many ways, and you wonder to yourself, is that right?
Well, what you want, of course, with the mask is you want a mask that's going to cover both the nose and the mouth. One of the things I see, of course, commonly is people, they don't like to have it over their nose. They'll just have it over the mouth. That's not going to do the trick. If you're lucky like me and have a big nose, you can easily just hang it right there. Ideally, you also want something that's going to be snug against the face and the chin to try to prevent droplets. And how that attaches to your face can be done in different ways. This has these little ear loops, but there are other ways that you can do it too. As long as you're covering both the nose and the mouth.
Now, just a quick tip. I know people who wear glasses. I have glasses on. I saw you had them on your head there for a little bit. Yeah. How do you wear a mask and glasses at the same time without
getting them fogged up?
Yeah. Is there a way?
Yeah. That's a secret that I'm just going to take to my grave, Chris. I feel no. I don't know. That can be a tough one. I have found that if you push the glasses farther down the bridge of the nose, the more space you have, the less likely they are. So instead of having the glasses like here, if you have them down here, then it's less likely to fog up.
Okay. I'll have to try that. So why do you think people won't wear them?
I think it's a couple things. I think, number one, a lot of people have what I will call COVID fatigue. People are just tired of having to deal with this and to think about this and to, have such a big impact on their day-to-day lives. And believe me, I'm very sympathetic to that feeling. I think also a lot of people think, well, I'm young, I'm healthy. I'm not going to worry about this because, if I get this infection, odds are I'll be fine. And that may be true. But of course, the problem is that even if they're fine, the other people around them may not be. And if you get this virus, on average, you are going to spread it to 2 or 3 other people. And those 2 or 3 other people, they may not do so well with this virus, right? They may be older. They may have problems with their heart or their lungs. They may have diabetes or obesity. They may be pregnant, right? And all of these scenarios can result in a much more increased risk of having to go to the hospital because of this infection, having to wind up on a ventilator in an intensive care unit, or even dying as a result of the infection. So, I think it's just a lack of awareness sometimes that people think, I'm not going to worry about myself. But really, it's not just about you. It's about everybody else in the community. And when you wear the mask, you're protecting them as much as you're protecting yourself.
Is that the way you shift that perception, is to kind of put the burden on the fact that they could affect other people?
Well, I think knowledge is key, right? And we want to impart as much understanding as we can. As much as the fatigue has worn people down, at the end of the day, wishful thinking isn't going to get rid of the virus, right? It's still going to be here, and we still have to deal with it. And this is how we deal with it.
So I'm sure it's frustrating for you as a health professional to see people not wearing masks. I'm sure you're out and about, and you're maybe in Wise Markets or Giant or any other store, and you see them not wearing masks. That's got to be rough to see.
Yeah, it is. It definitely makes me sad. I will say, and I realize though that for the most part, it's just a lack of understanding. I think if people really understood what was going on and the benefits of the mask and the value of it, I think there'd be a lot more compliance. I think also if people understood that, we've done a great job in Pennsylvania of bringing down the number of cases, right? Because of all the measures we put into effect fairly early on in the outbreak, we saw the number of cases drop precipitously after our surge in the spring, down to, maybe about 300 or so new cases per day. But and that has allowed the state to open back up. The counties have, gone green, right? But as that has happened, people have put these measures aside, not just the masks, but also being less conscious about the social distancing, the hand hygiene, the unnecessary, travel. And we've seen the number of cases are starting to kind of go back up. I mean, I think the other day we had 900 new cases in Pennsylvania, right? So the trend is now going in the other direction. And this is why Governor Wolf, of course, has been putting in these mandates recently to try to stymie that curve again. Because if we don't, and the case counts continue to climb, and we even have another surge, the counties are not going to stay green. They're going to go back to yellow, or they're even going to go back to red. And it's going to be even harder for us. So this is the chance. This is the time. This is when it's important for us to engage in these measures.
Now, Walmart yesterday said you have to wear masks. Target today said you have to wear masks. CVS said today you have to wear masks. How much does that help, number one? Number two, how much would it help if there were a national mandate? I saw one person said that if everyone wore masks, this virus will be gone in 2 months. Any truth to that?
Yeah,
and how much would it help?
That's true. Actually, that was said by Ed Redford, the director for the CDC. If everybody wore masks, that's true for somewhere in the neighborhood of 4 to 8 weeks. We could probably completely stop the spread of the virus and bring cases to zero. So, yeah. I don't know what else to say.
Okay. So I don't want to scare or depress anyone, but I did also hear something else that said that, and I think you and I discussed this the last time you were on. They said, this person said we could be wearing masks for years. Is that a little extreme?
Well, it's possible. In theory, what you want to do is you want to get to a point of, what we call herd immunity, right? Where you have enough people in the community setting that are immune to this virus. The problem that we worry about is the durability of the immunity is likely not going to be super long, meaning that even if you have the infection, you recover, and now you have some immunity to it, it probably will wane over a period of time. We don't know exactly what that will look like just yet. We haven't had enough studies to know, but we know from other coronaviruses that's the case. And so you have to have enough people immune. Probably the only way we're going to get there is with an effective vaccine. And even then, that vaccine may require boosters. in order to maintain immunity over an extended period of time. And so if that's the case, in order to get enough people vaccinated and to establish enough herd immunity in the entire country, it's probably a 2-year process. But these are guesses right now, right? Based on some hypotheticals, and we look forward to learning more this coming year.
Yeah, because I mean, even if a vaccine is available by the fall, we would still have to wear masks.
Yeah, again, until you have enough of the virus under control in the community, the mask is still going to be the most important tool we have for preventing the spread of it.
Okay. Dr. Stanley Martin, the Director of Infectious Disease, as I put my mask on, with the Geisinger Health System. There we go. We are both masked. Thank you very much for your time again today, and your insight, your information is always amazing for us.
Well, you're very welcome, Chris. I'm glad to participate.
Okay, and everybody, please wear your masks and have a good day, and we will be right back.
Stay healthy.